Hi, my name is Mariana. I just last month graduated with Associate Science in Nursing from Miami-Dade College. I'm originally from Ukraine and I live in Miami already for a while, for about 10 years. I always wanted to become a nurse, so it took several years before I can start the program, but I'm glad I did and I'm here. I decided to start bachelor program right away from associates, so while I still kind of ready and prepare for all nursing school stress, and I feel like at the moment transition is the easiest, plus I already have all my prerequisites, so I don't want them to expire, and I always wanted to have bachelor from beginning of my nursing studies. There are several reasons to it. One of them is a lot of hospitals already require for nurses to have bachelor degree just to be higher in position. Second, I feel like with bachelor degrees there are more possibilities open even outside of hospital for nurses, and it's always good to have some options. Because for now I'm planning to work with hospital, but I never know, maybe in a few years I will change my mind that it's always good to have another possibilities. And lastly, I also entertain the idea of becoming a nurse practitioner. I'm not quite decided about it yet, but I would like potentially to pursue it and have my own practice. It would be wonderful. If I feel adequately prepared for my nursing job and my role as a nurse, well, I feel confident about getting a job, like launching a new job as a nurse, and I'm ready for learning and practice that come with it. But I'm very well aware that I need to practice and master almost all of my skills. Yeah, I do have some knowledge and some practice from clinicals. I probably understand what I'm capable to do, what I'm not, and where I need to ask for help, what I can do on my own. But I understand that I still need a lot of practice. So I hope that hospital gonna provide really good training and good preceptor, and hopefully it's all gonna go great. But I am ready for a lot of learning, a lot of practices, and a lot of tries. And about burnout throughout nurses, unfortunately the program is very real and very big. I feel especially it was start being noticeable after COVID pandemic, because a lot of nurses were so exhausted that they just couldn't take it anymore and they left the job. Even now during clinicals, it was already a few years after COVID, I saw how busy are some nurses. It also depends on the unit and on the nurse, but some of them are super stressed out because the assignment are so big. Some of them have more patients than they probably should have. Also depends on how critical our patients are, and yes, some nurses had maybe great day because they have adequate time to take care of every patient, but some are super stressed out. So what is the solution I see with it? Well, first of all, it's adequate staffing, to have adequate amount of nurses, that nurses didn't have more patients than they should. Other, it's assistive personnel, which I feel they can do a great help, because to have more of them would be beneficial. Because what I normally see is that there is one PCT for about 10 patients. Probably if they would have one PCT per 5 patients, and maybe if they would do assignments at PCT have the same patient as a nurse, probably in my opinion it would be helpful. And another thing that I believe it would be beneficial, it's some better way of chart, because charting it's take way too much time from nursing shift. Nurses have to spend at least couple hours a day, if no more, just charting. And maybe with artificial intelligence there could be effective way to chart good but faster. Well, it's my perspective on it. I wish everyone great semester and good luck.